When you think about businesses that are selling through the roof, Allbirds or Skims, sure, you think about a great product, a cool brand, and brilliant marketing. But an often overlooked secret is actually the businesses behind the business, making selling, and for the shoppers buying, simple. For millions of businesses, that business is Shopify. Nobody does selling better than Shopify, home of the #1 checkout on the planet. And the not-so-secret secret, with Shop Pay, that boosts conversions up to 50%, meaning way less carts going abandoned and way more sales going. So if you're into growing your business, your commerce platform better be ready to sell wherever your customers are scrolling or strolling on the web, in your store, in their feed, and everywhere in between. Businesses that sell more sell on Shopify. Upgrade your business and get the same checkout Skims uses. Sign up for your $1 per month trial period at shopify.com/audioboom. All lowercase. Go to shopify.com/audioboom to upgrade your selling today. Shopify.com/audioboom.
Fall is all about cozy comforts, but when you're prioritizing your health, it's easy to feel like you're missing out. With Hero Bread, you can enjoy all your fall favorites because they're made with Hero Bread sliced bread loaves, tortillas, bagels, dinner rolls, and more. Try their all-new Hero Noodles with 12 grams of protein and just 80 calories. You won't believe Hero Bread's options have 0 to 5 grams net carbs and are high fiber from the taste and texture. They've even got small batch drops of indulgent favorites like the popular Hero Croissant. And right now, Hero Bread is offering 10% off your order. Go to hero.co and use code FALL25 at checkout. That's FALL25 at HERO.co. All figures are per serving of Hero Bread. Contains 2 to 18 grams of fat per serving. See the product nutrition panels on hero.co for more information.
Hi friends, this is Dr. Corey Emanuel, media psychologist, mental health advocate, and founder of Men Talking Shift. The Broken Cycle Media team is excited to offer a new series of educational episodes, which we're calling Data Points. These special episodes will include educational information, statistics, and support on different topics that are important to our community. Thank you so much for listening. While mental illness can affect people of all racial and ethnic backgrounds, this month we shed light on the unique challenges that racial and ethnic minorities in the United States face when it comes to mental health challenges as well as mental health illness. Regardless of your racial identity, if you've experienced disruptions in your thoughts, behaviors, or moods affecting your daily life, this episode will offer valuable insights, empowering you to better understand your mental health and provide you with helpful tools and strategies to improve your well-being. Mental health encompasses emotional, psychological, and social well-being, influencing how we think, feel, and act. It is not merely the absence of mental illness, but rather a state of overall well-being, characterized by resilience, effective coping strategies, and the ability to navigate life's challenges. Wellness is on a continuum, ranging from optimal functioning to severe distress, where we may experience varying degrees of mental well-being at different points in our lives. This spectrum approach acknowledges that mental health is fluid and can fluctuate over time, influenced by factors such as stress, trauma, racism, social support, and access to resources. As studies cited by the CDC show, minorities in the United States face unique challenges regarding mental health due to systemic inequalities and disparities in access to care. Mental illness is considered a critical area of concern for minorities due to higher rates of poverty, discrimination, trauma, and limited access to culturally competent mental health services. Research indicates that minorities, particularly Black and Hispanic individuals, are less likely to receive mental health treatment compared to their white counterparts, contributing to disparities in mental health outcomes. While some reports indicate that mental illness is more prevalent now than ever before, other data suggests people of color face pre-existing disparities in access to and receipt of mental health care, which may have worsened during the pandemic. For instance, according to analysis of the National Health Interview Survey by an independent source for health policy research, 53% of Black adults with anxiety or depressive symptoms were not receiving care compared to 36% of their white counterparts before the pandemic. A lack of mental health care is a trauma in and of itself, causing a persistent and overwhelming sense of powerlessness and shame. Social determinants play a significant role in shaping mental health issues among minorities in the United States. Factors such as socioeconomic status, education, employment, housing, and access to healthcare services disproportionately impact minority communities, leading to increased levels of stress, trauma, and mental health challenges. Data also shows that racial and ethnic minority groups throughout the United States experience higher rates of illness and death across a wide range of health conditions, including diabetes, hypertension, obesity, asthma, and heart disease when compared to their white counterparts. Additionally, according to data from the National Institute on Minority Health and Health Disparities, the life expectancy of non-Hispanic Black Americans is 4 years lower than that of white Americans. As published in a 2022 study in the Translational Psychiatry Medical Journal, racism also poses a mental health threat. For instance, racial discrimination and stigma may contribute to feelings of isolation, low self-esteem, and psychological distress among minorities, exacerbating existing mental health issues. Additionally, according to a study published in the 2023 Mental Health Community Journal, traditional masculinity norms may exacerbate mental health issues among Black men, as societal expectations to conform to rigid ideals of strength, stoicism, and self-reliance can discourage help-seeking behaviors and emotional vulnerability. The same research suggests that Black men are less likely to seek mental health treatment due to fears of being perceived as weak or emasculated, leading to higher rates of undiagnosed and untreated mental illness. Further, despite Black Americans making up only 13.6% of the U.S. population, approximately 37% of those incarcerated are Black or African American. Meanwhile, evidence from a 2014 article in the American Journal of Public Health suggests that one of the greatest predictors of incarceration is a mental health ailment. These data points correlate to the fact that disparities in treatment may very well continue to exist when a formerly incarcerated person reintegrates into the community, particularly when the same pre-existing barriers in accessing mental health care persist. This is potentially further compounded by the stigma associated with having been incarcerated. It's nearly impossible to present the topic of minority mental health and not address today's youth. The intersection of suicide and mental health issues poses a significant concern for minority youth who face elevated risk factors such as exposure to violence, trauma, discrimination, and social marginalization. Research indicates that minority youth, particularly Black and Indigenous youth, are at a higher risk of suicide ideation, attempts, and completion compared to their white counterparts. For instance, according to statistics shared by the American Association for Medical Colleges, Black children ages 5 to 12 are twice as likely to die by suicide as their white peers, and Black teen suicides are growing at equally alarming rates. One prevalent issue amongst Black youth is that they are oftentimes assessed as having a behavioral problem rather than having a mental health concern, which can lead to adulthood feelings of invisibility, neglect, and misunderstanding, fostering a sense of powerlessness. Addressing the underlying mental health needs of minority youth requires culturally sensitive interventions that consider the unique social and environmental stressors they face. Effective treatment and intervention options for minorities involve culturally competent approaches that acknowledge and respect individuals' cultural backgrounds, beliefs, and values. Culturally tailored interventions such as culturally adapted therapy, community-based programs, and peer support networks can help reduce barriers to care and improve mental health outcomes among minorities. Additionally, increasing access to affordable and culturally responsive mental health services, expanding outreach and education efforts, and addressing systemic inequalities are crucial steps to promoting mental wellness and reducing disparities in mental health care. Thankfully, there are organizations and even free resources available for minority mental health. For example, the Black Emotional and Mental Health Collective, better known as BEAM, exists to remove the barriers that Black people experience getting access to or staying connected with emotional health care and healing through education, training, advocacy, and the creative arts. When you visit beam.community, you'll not only find a directory of licensed mental health professionals, but you'll also instantly gain access to programs, grants, free workshops, and wellness tools to support you on your mental health journey. If you're thinking about suicide or worried about a friend or loved one, or would like emotional support, please call the Lifeline Network at 988, which is available 24/7 across the United States. Remember, if it appears that someone is experiencing a mental health crisis, please contact your local mobile crisis unit. Not only will it ensure the safety and well-being of everyone involved, but it will provide the appropriate care and support for the person who is in need of a safe and tailored intervention. This proactive approach can prevent situations from escalating to the point where law enforcement may feel compelled to use weapons or force, while also promoting a compassionate response that prioritizes mental health and de-escalation. Addressing mental health disparities among minorities requires a multifaceted approach that addresses social determinants, challenges traditional masculinity norms, and provides culturally competent care and interventions. By recognizing mental health as a spectrum and understanding the unique experiences and needs of minority communities, we can work towards creating a more equitable and inclusive mental health system that promotes well-being for all. For more information and resources on minority mental health, please visit lifeforall.com/minority-mental-health. And don't forget, for a list of nonprofit organizations and resources, please visit somethingwaswrong.com/resources. I'm Dr. Corey Emanuel, and you can follow me across social media at Corey Emanuel, that's CoreyEmanuel, or visit my website at CoreyEmanuel.com. Thank you so much for listening and learning with us.
When you think about businesses that are selling through the roof, Allbirds or Skims, sure, you think about a great product, a cool brand, and brilliant marketing. But an often overlooked secret is actually the businesses behind the business, making selling, and for the shoppers buying, simple. For millions of businesses, that business is Shopify. Nobody does selling better than Shopify, home of the #1 checkout on the planet. And the not-so-secret secret, with Shop Pay, that boosts conversions up to 50%, meaning way less carts going abandoned and way more sales going. So if you're into growing your business, your commerce platform better be ready to sell wherever your customers are scrolling or strolling on the web, in your store, in their feed, and everywhere in between. Businesses that sell more sell on Shopify. Upgrade your business and get the same checkout Skims uses. Sign up for your $1 per month trial period at shopify.com/audioboom. All lowercase. Go to shopify.com/audioboom to upgrade your selling today. Shopify.com/audioboom.
Hey there, True Crime Podcast fans. It's Patrick and Jillian from True Crime Obsessed.
Each week on TCO, we recap a true crime documentary everyone's talking about, and we do it with heart, sass, and just the right amount of humor.
So if you like the kind of podcast where two good friends chat about a case in a thoughtful way that centers the victims, you really got to check us out.
Yeah, we cover the well-known cases that you hear about in the news and the underreported cases that desperately need more attention.
For almost 9 years, we've been one of the most popular true crime podcasts out there.
We have over 30,000 five-star reviews on Apple Podcasts, and our brand new YouTube channel has over 50,000 subscribers watching our full-length video episodes too.
So find and subscribe True Crime Obsessed wherever you get your podcasts.